Hello, my name is Dr. Amy Patel. I'm a breast radiologist, medical director of the Breast Care Center at Liberty Hospital, managing partner of Alliance Radiology, and assistant professor of radiology at the University of Missouri Kansas City School of Medicine. I'm also the current president of the American Association for Women in Radiology. Today I'm going to discuss why we continue to have a lack of women entering the field of radiology, and going even further, why are there a lack of women in radiology assuming positions of leadership? Historically, when you look back at radiology, over the last century or so, the percentage of women entering the field of radiology has been around 23 to 29, 27% in the 20s. We just haven't made the progress that we'd like to see of women entering the field. Now, a recent study in radiology looked at women in positions of leadership in the field. And when you look at from 2010 to 2019, for example, the number of women chairs has only increased from 13 to 17%. When you look at private practice, the number of a percentage of presidents who are women is even lower. So why do we continue to have these issues? Well, when it comes to women entering the field of radiology, there have been many publications about this, and many reasons have been cited of why women may not be entering the field of radiology. Number one, many medical schools do not have a mandatory medical student rotation, and so there's this lack of exposure. So if somebody who is a woman wants to go into the field of radiology, an elective has to be undergone, or perhaps they know somebody who has gone into the field of radiology. There just may not be that mandatory exposure. Also, misconceptions. They are playing a role. That perhaps that radiology is a specialty where we're in our dark rooms all day and have no patient interaction, where we know we have a lot of patient interaction, particularly in certain areas of radiology such as breast imaging, interventional radiology, and even pediatric radiology. Radiation exposure, potentially if you're pregnant, what are the implications of that to the fetus when you're pregnant? There are myths surrounding that. Perhaps finding radiation physics daunting when studying for your core and certifying exams, your board examinations. So there are many reasons that have been cited of why women may not be going into the field. And then when there aren't a lot of women going into the field, you think about women who are assuming positions of leadership in radiology, which is even fewer. And if there are less women in positions of leadership, there are less inspirational figures of which medical students can aspire to want to become. For me, going into the field of radiology, it all stemmed from two wonderful women radiologists who really encouraged me, guided me, and really demonstrated leadership. And we need more of those women leaders. Particularly in the American Association for Women in Radiology, we are trying to do our part when it comes to mentorship and sponsorship of a new generation. Under the wonderful hard work and tenacity of our medicals, particularly our member and training committee, they have devised a mentorship program where a mentee, specifically a trainee, is paired up with a mentor who is a practicing radiologist. And we are hoping that with this mentee-mentor relationship that we can inspire a new generation of women to enter the field of radiology. Specifically at my institution, I'm the faculty advisor of our medical student interest group. And we are really trying to encourage and expose medical students to radiology through various activities and really diversify the exposure to these medical students. As a result, this year alone, we had 13 medical students at UMKC go into radiology, 8 men and 5 women. So I know even at my institution, we need to continue to work to achieve parity when it comes to the number of men and women going into the field. But these numbers really do give me hope. We're also working on other ways to expose medical students early. Ideally, it would be wonderful to have a mandatory medical student rotation for radiology, and I think we all are striving for that. But in the meantime, we are trying to integrate and have been integrating radiology curricula into early curricula that the medical students are taking into a class called clinical correlations when they're in their second year of medical school in the 6-year medical program that we have at UMKC. And also, we offer some really wonderful electives for radiology, for medical students here. Interventional radiology, a general radiology rotation. In fact, we have 2 of those, and specifically a breast radiology rotation where medical students rotate at our institution, and particularly at the breast center at which I practice. So it's really going to take a boots on the ground approach and recruiting the best and the brightest early. So I'm talking a lot about the medical student level, but really it should start from the high school level. And specifically, we are doing some really wonderful things to reach out, particularly to high schoolers in the Kansas City metro. So pipeline creation is so crucial to the recruitment of women in radiology. And hopefully over time, we will see these numbers changing, and then we will see more women in positions of leadership in our field. We need everyone, though, to be involved with this, whether you're in academics, you're in private practice, women radiologists, male radiologists, all radiologists. We all need to work together if we're truly committed to wanting more women in the field and wanting more women in the positions of leadership in the field of radiology. That will only strengthen our profession and make us even more successful in the years to come. Thank you.